Good morning, everyone. I'm Jill Chadwick. I'm in for Dr. Stephen Stites, Chief Medical Officer, and we are coming to you from the Dolph Simons Jr. Family Broadcast Studio. We have a very packed update today. Our guests are joining virtually from 3 metro area counties to update vaccination and infection rates and react to the news of the variants popping up around us. We're going to introduce you to everyone in just a moment, but first, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, is here with our numbers. Yeah. I hope my cast is not too distracting. We might as well
fine.
Get the elephant out of the room. I may get this off on Friday, so I'm very excited.
It's been on a while.
Yeah, it has. 6 weeks.
Our numbers, we're doing a little bit worse. So I think on Friday maybe we had 8 acute infections. Today we have 12 acute infections, but 5 in the ICU and 2 on the ventilator, 12 in that recovery period. So we're still at 24 total patients, but it's more concerning that the number of new or acute infections has gone up, by 50% compared to where it was Friday. Hays still has a low number. They have 3 total patients, 2 in that active time and 1 in that recovery period. And we were able to go through in some of our 12 acute infections and look at vaccination status. There are 3 patients that are older that have had vaccines, older than 55. But in those 3 patients that have gotten their vaccines, 2 of them were asymptomatic. They were admitted for another reason, and then 1 is symptomatic. So again, understanding and knowing that you can still test positive and get the infection after vaccine is a big deal, and we know that can happen, but it will significantly reduce your risk of severe disease and needing to get on the ventilator, and of course death.
So if I heard you correctly, the people that are older that had the vaccine came to us for another reason, and then we do our normal testing that we do, and you discovered they had COVID.
Yeah, 2 of them. Yep, we were just doing our typical screening whenever you come into the hospital for everybody that gets admitted.
Wow, it's really interesting as we track that. Speaking of our inpatient numbers this past week or so, our admissions have included people who are younger adults, people in their 20s and 50s, and they've been quite sick. While concerning, we asked our Vice President of Performance Improvement, who is also our numbers guy during the pandemic, to put this into perspective. Here's Dr. David Wild.
Well, one of the questions we get very frequently is, are younger patients being admitted to the hospital more now? Or are we seeing a larger percentage of those that are needing hospitalization in younger age groups? And so here's what that actually looks like. The short answer is yes, although by younger patients, we don't always mean people in their 20s or their 30s. So this graph compares in blue the percentage of our admissions in October, November, and December of 2020, sort of the peak time for hospitalizations, to the same age groups in red, the percentage of the admissions in March and April as of today. So this is a look at the breakdown or the proportion of individual age groups, and this is sort of by 5 years here, or in 5-year age buckets, comparing several months ago, right, when things were at their peak, or previous peak till now. And you'll notice here that the blue bars, the November, December, or October, November, December time frame is much more skewed to the right, meaning to the older ages. So you can see that the 70 to 75 and the 75 to 80, for example, are much, much higher in blue than they are in red. That now there's a much lower percentage of those really older than 65 in the hospital compared to before. And that's sort of paired with this increase in the 55 to 60 and 60 to 65 age groups, most pronounced there, but also some increases in the 50 to 55 and even, say, the 40 to 45 and the 25 to 30. So you can see for each of those buckets where the red line is taller or higher than the blue line, those are the age groups that we are seeing a higher percentage now. So our highest group, for example, in March and April has been that 60 to 65 year age group. Not young, right? Not 20 or 25, but definitely not the 70 or 75-year-old age groups that we saw before. Interestingly enough, anecdotally, we have seen a few things. This week, for example, all of our ICU patients here for COVID are less than 50, and some are in their 20s. And so we are also seeing more younger people with severe disease. But the general answer is we're seeing less in the 70, 75, 80, 85-year-old age groups and more in the 40 to 65. The next slide here tells a bit more of that story, though. So we've mentioned a couple of times that the wastewater treatment testing, so looking for the genetic information, the mRNA, from the SARS-CoV-2 virus. How many copies can we find in a specified amount of wastewater is actually becoming the more important marker of disease in communities. And here's why. This is data shared publicly from Lawrence, but it tells more of the story than just symptomatic testing. And by that I mean that for weeks now we've been saying the rate of testing, I'm symptomatic and so I'm getting tested for COVID, per 100,000 residents in Kansas is extremely low. It's been declining. In many cases, it's one of the lowest in the country. And that, of course, means that we're finding less COVID disease in symptomatic patients because we're testing less of them. But when we look at the wastewater treatment, we see some we see some interesting things. So here, the green line is the symptomatic testing. That's the number of positives over time. And the orange and the blue dots are sort of, think of it as the amount of SARS-CoV-2 or COVID-19 genetic information found in the wastewater treatment plant in the two wastewater treatment plants in Douglas County and Lawrence. And so you see here that the blue, right, that treatment plant serves a specific population, and it is close to or very similar to levels leading up to the last surge, while the orange is lower but trending up over the past few weeks. And so all that means is that in different areas in town, disease transmission is happening at different rates, but it's definitely not at the level, the low level of disease that we see with symptomatic testing. And so when we talk about the testing not telling the whole story in Michigan or in New York, this is what we mean. This is a local look at that sort of phenomenon. When we measure the amount of disease present in our wastewater, which is a good marker of the amount of disease present in our community, it's not nearly as low as that symptomatic testing value, which tells us that there's probably, and in fact very likely, more disease, more COVID in our community than our testing numbers, our positive numbers, our positivity rate leads us to believe.
All right, thank you, Dr. Wild. Does any of what Dr. Wild just said surprise you? I mean, the younger people in the ICU, the infection rate around us?
Mm-hmm. Yeah, I mean, it's always tough to follow a good wastewater story. But I think that does tell because we have seen where testing rates in some communities have gone down. We know that COVID weariness can occur even if you are ill. You may feel that you have it, so you don't want to go get tested. So we are seeing, probably a lot better picture of what is going on by looking at hospitalizations, because for one reason or another, people may not want to be testing. But of course, testing that wastewater where we can get unbiased, large amounts of samples from around the community is probably a better estimate of really the amount of prevalence of disease out there.
It's something to think about because the weekend was so great. Everybody was out.
Yeah,
I mean, out in my neighborhood, out.
Yeah, hopefully doing things outdoors again in the thoughtful manner and keeping spacing from each other.
Yeah. Before we introduce our guests, are there any reporter questions on the line?
Sure. Good morning. Cody Holyoke from Channel 9.
Morning, Cody.
Happy Monday. Hi. And Dr. Wild touched on this a bit, but as you start to see younger people, I know this is certainly a national trend, the U.S. still seeing an increase in cases and hospitalizations, especially among younger people who haven't got a vaccine. For the lay people here, what are the main concerns then? How do you take that information and turn it into a plan of action? What should we be doing, and what are your concerns?
I think there's many issues there. We are concerned with hospital capacity, as we always have been. Luckily, In our community, we've really always been good on hospital capacity as far as since the pandemic started. We haven't run out of PPE. We haven't run out of those critical drugs. So that's always the concern. It's also the concern about the young people who are a majority of our workforce, and that is the essential workers, the people in our supply chain, making sure that they are staying healthy and staying able to work. And so thereby, we need to continue the message of getting vaccination because we know how important that is. We have seen now data showing that vaccination prevents asymptomatic disease, symptomatic disease, and of course, most importantly, hospitalization and death as well. So we need to continue to give that message that the vaccines that we have are safe and very effective. They can keep you healthy, keep you and your loved ones healthy, and thereby also hopefully keeping you at work and continuing to do those things. So I think it's continuing the messaging of the way that we are going to get out of this pandemic and the way that we are going to get back to things more normal in 2019 compared to 2020 is to continue to promote the vaccine. So, we're certainly going to be able to continue to do that.
Are there more questions? Last call for reporter questions. Do you have Amy's, I think?
Yeah, okay, I'll ask it.
Okay,
Yeah.
Jessica's here, and she just now woke up and joined the party. Good
Thank
morning.
you. All right, so Amy wants to know, so she went out for the first time to a restaurant. They went back, felt safe on the patio where they were sitting, but the guy next to them was smoking a cigar. The smoke was coming right towards their face, so they ended up moving tables. So she's wondering if cigarette or cigar smoke coming out of someone's lungs and into the air can spread COVID. Seems like restaurants should be telling people to keep their smoking to themselves.
Yeah, I think we had this question a while ago, a couple times, wondering about smoke and can it spread on smoke. And Dr. Stites and myself really didn't feel a lot of danger in that, a lot of high-risk situation. Again, you did the right thing. Being outdoors is much better if we're talking about the disease and the droplets that spread the disease as they are expelled into the environment. With the turbulent airflow, even a little bit of wind, that's going to disperse the virus in very, very low concentrations. The droplets in very low concentrations where your risk of getting it is not as high as indoors. So I don't think there's a lot of risk there in that scenario that she painted at all.
All right, any other questions? Okay, we are so pleased to introduce today's guest. Joining us from Johnson County is the Director of Health and Environment, Dr. Sanmi Areola, from the Shawnee County Health Department, Infectious Disease Division Manager, Derik Flerlage. And on the Missouri side in Jackson County, we welcome the Health Director, Bridgette Shaffer. Yeah. We thank you all for being here. We wanted to ask you to give us an update on vaccination and infection rates in your counties. I'm going to go to Johnson County first, and Dr. Areola. Good morning.
Good morning, Jessica. Thanks for having me. And Johnson County, we are vaccinating as broadly as we possibly can. Infection rates remain fairly low. It's not quite down to the level that we want. We track incidence rate over 2-week periods. Right now, for the past 3 weeks, we have been at around 74 cases per 100,000 residents. Positivity rate is hovering around 3%. And like has been said earlier a couple of times, those numbers, we have to be careful with how we interpret them, largely because we're just not getting broad testing. And so while it's comforting that it's not quite as high as the numbers were in November, December last year, we still have a lot of work to do. Now, one of those key things that we are very happy about is that we have vaccines. And we have focused a lot of attention on getting people vaccinated. We are getting more vaccines from the state, which means more vaccines in more arms in the county. And we are opening up more appointments weekly right now between first and second doses. We have increased appointments to about 11,000 vaccinations a week. Of course, our approach from the start, we understood that our approach will not be effective if access to vaccination is only going to occur in the one or two clinics that we open. And so we have been working with our partners in the local public health system, and that includes KU health system, includes all the other health systems, and we're getting more vaccine and we're getting appointments. We are vaccinating in the county. We are having a special focus on our vulnerable population. We are having a focus on our minority population. We are taking vaccines into homes to vaccinate those that are homebound. We are working with our transit authority for those that need help with transportation. We have a Thursday transportation clinic where we are vaccinating those individuals. This past week, we changed the hours for our clinic so that if you're working 8 to 5, you still have opportunities to get vaccinated. So our clinics are now open 9 a.m. to 7 p.m. Tuesday, Wednesday, Thursday, and open also on Saturday 9 to 12. A lot of opportunities to get vaccinated. I will say that thus far, every appointment that we have opened has been taken up. We opened about 10,000 appointments, 11,000 appointments this week, with about 7,900 of them first doses. They're completely taken up. We're going to be opening up additional for the next couple of weeks. So the uptake of the vaccine is still pretty encouraging. We are working to increase our education around those that are still hesitant to take the vaccine. But that's kind of what the picture is. We are vaccinating as broadly as we can, as quickly as we can, and we're continuing to educate the public that vaccine is one of those components. Our best case scenario is as we vaccinate, people continue to wear masks and physical distance.
Right. Dr. Areola, forgive me if you said this, but what are criteria for getting vaccine in Johnson County? Is it come one, come all, or do you have criteria?
So if you live in Johnson County or you work in Johnson County, you are eligible for vaccination. So if you are over the age of 16, you qualify. If you live or work in Johnson County, so if you are eligible, it's pretty much come one, come all. But for the purposes of our clinic, the Department of Health and Environment Clinic, we do require appointment, and I know that several of our other providers require appointment. But everyone who is 16 plus who live or work in Johnson County is eligible to get vaccinated.
All right. Thank you very much. Don't go anywhere. We'll be back with you in a moment. Derik in Shawnee County, good morning. Same questions for you. Update your vaccination and your infection rates.
Yeah, sure. Thanks for having me back. It's amazing how much can change. I think last time we were on here was maybe a month or two ago. Infection rates here in Shawnee County, they have kind of been ebbing and flowing, and I think I can echo a lot of the same sentiments from Dr. Areola there in Johnson County. And so when I look at our indicator, we have a COVID community indicator, which is located on our dashboard, shawneehealth.org, and it's always reflective of the week past. So the most recent one that we have is from March 28th through the 3rd. And our case count for that week was about 95, which was an actual 30% decrease. But the week before that, we had a 22% increase. And so we're having to watch kind of some of those. In fact, if you go to our dashboard and look at the daily case count by case date of diagnosis, you'll notice that there's a roller coaster. I mean, it quite literally looks like a roller coaster. But our percent positivity is hovering the same as Johnson County, right around 3%. We've seen it kind of fluctuate from about 2.5 to close to 4 sometimes, and so we track that on a 7-day rolling average as well. So we can't stress testing enough. We have seen our testing numbers decrease pretty substantially for the last month or two, and so as the health department, we do have testing available, and that information is out there as well. If people want to request testing kits, businesses can request testing kits as well. And so we are definitely willing to provide those as well. You do not have to be symptomatic, and we can definitely answer any questions on testing as well. That has to be a big focus right now. As far as vaccination here in Shawnee County, as everybody knows, we've had phase 5 that opened up back in late March. And so that's kind of, we're eligible for really everybody. You can see there on the screen. That's a graphic from our website as well. We do have a vaccine dashboard. So we're phase 1 through 5. And again, I can't stress enough that 5, 4, 3, 2B, 2A, and phase 1 can all receive a vaccine at this moment. If people do have questions, we have a COVID vaccine at snco.us email that people can email into. We also have a phone number line at 251-4949, and those are on the screen there under the notes section. And so we were excited to have the phases open up once the state kind of moved us forward. And to that note, we have been able to, I know my next slide will say about 51,000 individuals. That was when I made the presentation here. I am happy to say we're approaching about 60,000 residents of Shawnee County that have been vaccinated now. And so we're very happy about that. We're receiving approximately 4,000 to 5,000 doses a week and kind of working through that Shawnee County collaborative. We do have a total county population of a little over 175,000 people. What's important to consider, though, is that a sizable chunk of them are under 18 years of age. And as Dr. Areola said, only 16 and above, and in fact, only 16 and above can receive one of the 3 available vaccines. And so we have to take that into consideration when talking about the percent of the population that we've vaccinated to this point. Next slide, please. So kind of looking at some of our rates, we are doing favorably, I think. We try to compare ourselves to the other higher densely populated counties in the state. And so we're happy with those numbers. There's always room for improvement. We also know if we remove those children who are eligible, our rate becomes 439 per 1,000. And so we have looked at a lot of the numbers that go along with this. There's a Kansas Health Institute report talking about vaccine hesitancy and kind of anticipating about 25% of adults that are not interested in receiving the vaccine at this point. So we do have to take that into account. Again, working on education, answering questions, promoting the kansasvaccine.gov website, which has safety information for all 3 of the available vaccines. It'll take you to the clinical trial data, and people can read through that if they wish. And again, we're always welcome to answer questions as well. Next slide, please. So I just want to post this up there for everyone again. These are our providers in the Shawnee County Vaccine Collaborative, as we know it. And then we have a couple of pharmacies on there, which technically aren't part of our collaborative, but are offering vaccine in Shawnee County as well. That would include places like Dillon's, Walmart, and Hy-Vee. But we've had great success through our health department. We are offering some different mobile clinics and working with faith leaders in the community, working with racial equity groups in the community, really making sure that we reach those that are hesitant due to unfortunate, historical tragedies, and just being as open and honest as we can about this vaccine rollout. And again, answering questions about that as truthfully and honest as we can. And so kind of moving forward, we're going to lean on that collaborative. Stormont Vale Health, University of Kansas, St. Francis campus here in Topeka, they are both operating as full and as quick as they can. Unfortunately, we are seeing a bit of hesitancy here in Shawnee County and some slots that are open. So people who are interested, absolutely go to our website, go to that graphic there, call the phone numbers, email the emails, ask your questions, and sign up to receive your doses. So again, we're excited about moving forward here. We'll do our best to educate. And for the time being, I'll echo the same sentiments that Dr. Areola said once again. Continue your mask wearing and the other mitigation strategies. We have unfortunately seen those variants. The B117 UK variant is the only one we have confirmed here in Shawnee County. And we have 22 cases of those confirmed. I feel very confident in saying that there's a higher number than 22. So we'll continue working with KDHE as well as our other lab testing partners to identify more of those specimens as they come in.
Very good. Thanks, Derik. We are going to be talking about vaccine hesitation and also the variants in just a moment. But first, A very special welcome to Bridgette. This is your first time on the Morning Update. How would you describe the vaccinations and infection rates in Jackson County?
Yeah, thank you for the opportunity to be here today. As far as the infection rates in Jackson County, right now we're pretty much stabilized or hovering around 20 cases as a 7-day average for new cases per day. And so we've seen that for the last few weeks, and we had seen a steady decline, and now we've stabilized at that 20 cases per day as an average. As far as percent positivity, we too hover around 3 to 4% of percent positivity of our tests. So as far as vaccinations, we're really, really proud of our vaccinations and the team at the health department, as well as all the volunteers that have supported and assisted in our efforts. We expect by tomorrow we'll have given 50,000 doses from the clinics at the health department, which helps our county, return to more of a normal state. We're seeing about roughly 28% of our county has received their first dose of vaccine, and 19% of people have completed their series. We know we have a long way to go, and we're excited to continue to work with our partners as supply increases and opportunities increase throughout our county.
All right, Bridgette, thank you for being with us, and don't go anywhere because I have a harder, tougher question for you when we come back in a moment. But first, Dr. Areola, can you tell us what have been challenges to getting vaccine into the arms of people in your county? And do you have a success story to share with us?
Thank you, Jessica. In Johnson County, as at last Wednesday, which is the weekly data that we receive from the state, we have given about 273,000 vaccinations, with 174,000 plus haven't received at least the first dose. So that represents pretty close to 40% of our population. And since then, we have vaccinated. So without a doubt, we have given at least 40% of our residents at least the first dose, which is good progress. So some of the success stories for us is we were pretty clear when we started that we don't want to create a bottleneck where people are only able to get vaccines in the clinics that we open. Now we have given more vaccines than other health systems and other partners, but our health systems have been very critical to what we have done. People will remember when Governor Kelly intentionally sent vaccines to vaccinate educators K through 12. By the time that came, we had already vaccinated about 40% of that population, working with the Children's Mercy Hospital. So to me, that's a success story. The approach to work with all of our health systems is another success story because our residents have relationships with the health system. That's where they go for their preventive care. That's where they go for other types of cares that they have. And data does show that people trust information coming from their doctors and their health system. So apart from being able to get the vaccine out, we, again, build on those relationships. And I think that's why we are continuing to see every appointment that we have opened up has been taken up. The problem that we've had in Johnson County hasn't been hesitancy per se. That may come later. It's been people just ready to take the vaccine, and maybe the vaccine was not available. I think the collaboration with Transit Authority to be able to bring people who have challenges with transportation is a huge development. We started that back in February, and a couple of weeks ago, we finished everyone that is 65 plus that indicated that they needed transportation help. We had vaccinated. The homebound vaccination, which we started several weeks ago, about 6 weeks ago, right now we are close to vaccinating 150 persons in their homes, and also partnered with the Area Agency on Aging to reach out to their residents who are homebound and also vaccinating in that population. And so when I see pictures and comments from 100-year-olds, a 103-year-old who's just happy that she could again now look forward to interacting with her children and grandchildren. Those are really good stories. And to cap that up is just the collaboration. Public health is very broad. It's not about the local public health department by itself. It's about the local public health system. So the collaboration with our health systems, KU Health System, Olathe Health, Advent Health, St. Luke's, Overland Park Regional, Menora, and Children Mercy. Those have been huge, and heart-to-heart health partnerships, just working very broadly, understanding that we are a very, very large county. I still get emails every day about residents that are upset about appointments. That's a good thing. They want to be vaccinated. We want to vaccinate them. So we're doing all that we can, working with our partners to open up appointments and get vaccines into their arms as quickly as we can.
Very good. Thank you, Dr. Areola. Derik, I know you said that like every county, city, community in America, you have some vaccine hesitancy. What other challenges are you having, and what is the success story in Shawnee?
Sure. So I think the challenges have changed week to week. When it first began, it was vaccine availability. And so we were, always wanting more, always needing more. And now we know that the Johnson & Johnson supply has been limited for the time being as well, due to some production issues. And so that's kind of a wanted need in the community that we've identified, and trying to discuss and educate those people on some of the hesitancy they may have around some of the different manufacturers of the vaccine as well. So we're working through that. Some of the bright spots in the community. So again, as Dr. Areola said, we're working with the collaborative that we have here in the county with all of our partners. We have been able to utilize some of our pharmacy providers to provide vaccine for our congregate settings, and that includes nursing homes. And so many of them were vaccinated by the federal partnership. And unfortunately, a few had received their first doses, but were unable to get their second dose. And so we have tried to provide for those. And of course, there's always kind of a rotating number of staff and new residents that are going into nursing homes, coming out, even into some of the home health arenas or assisted livings and independent livings. And so we've been able to utilize one of our willing pharmacy providers to go out to those settings and provide vaccine to those people that are interested in receiving, which is a fairly high percentage, especially in the vulnerable resident population. We've also have a homebound program here in Shawnee County. We had our first homebound patient vaccinated back in early March, March 8th, I believe. And then we've been able to partner with the EMS and paramedics. I'm used to saying pandemic, paramedics from the Topeka Fire Department that have started vaccinating our homebound individuals here in Shawnee County on April 1st. So we're very thankful for them. And I think, most of the success stories that I've heard lately have come from that homebound program. I talked to an older couple just a few weeks ago that had communicated to me that they had been scared to leave their home for a long while, for really the last year, and were moved to tears on the phone just by having that ability to have the vaccine brought to them. They also had some mobility issues, and so they were worried about that and getting to one of the clinics. And so it's really important trying to reach these underserved populations. We've also, again, I'm kind of echoing the same thing as Johnson County there, but we've also partnered with our local aging agency along with the city of Topeka. And back when we had phase 2 and 3 open, they were doing pop-up clinics for our survey. And now that the survey is no longer a great tool to schedule, they are actually using some of these clinics to schedule people that may not have access to internet or be computer internet literate is what that's called. And so we're just trying to cover all the gaps that we can and that we've identified. We have some dialysis providers that have been able to vaccinate their patients. And again, we have some of these mobile clinics too out at various churches. Citizen Potawatomi Nation Community Building in Rossville, Kansas, which is a rural community. We have a walk-in clinic for them here in a few weeks, April 28th and the 29th. And we're providing Johnson & Johnson vaccine out there. And so we're just excited about some of those mobile clinics and kind of the community collaborating together to provide for one another.
Thank you, Derik. Bridgette, I still want to do the French pronunciation of your name. What are the challenges and successes in Jackson County, quickly?
Yeah, so I think echoing what was said, vaccine supply has been one of our biggest challenges that we faced as the health department. For many weeks, we were receiving supply that was well below what our capacity was at the health department. And some weeks we didn't receive any vaccine. So it was very difficult to plan and execute vaccination events and clinics without that knowledge of what we'd be getting week to week. Now, as vaccine supply is increasing, both in amount and what's being distributed to public health, we are, more optimistic in what we're seeing now. And also similarly, our success stories really are ones that have been through partnerships. So partnering with our EMS agencies for homebound, working with community partners for homeless shelters and other homeless or organizations that serve the homeless population, working with Truman Medical Center on the mega mass vaccination event at Arrowhead, Community Services League that we've partnered with the Jackson County Detention Center and some of our school districts as well. So just all those partnerships have really been wonderful, and we've really enjoyed working with those groups and hearing the people's stories at the end of our clinics and what they've gone through during the crisis, as it hasn't been a easy year for any of us, just kind of reminds us of why we do what we do here in public health.
Of course. I have one more question for all three of our panel, and then we're going to move to the community questions. I'm going to start with Bridgette on this one. I think that Jackson County, and I could be wrong, but I think that they were one of the first to announce that they had tracked the B1351 and the B117, I think even just last week, variants. What are your thoughts about that, and what are your concerns? And also, didn't Jackson County kind of open wider their ability to move around? So talk to me about that.
Yeah, so currently our health order now aligns with Johnson County, Wyandotte, KCMO, Clay County, Platte County, where we still require masks, but we don't have capacity restrictions, but do require social distancing for public spaces. So when we look at the variants, and yes, we did have our first individual identified with the South African variant in a sample last week, we are concerned with the variants and the level of increased transmissibility and any kind of reduction in vaccine effectiveness and possibly increased severity of disease. And so we're continuing to monitor and research that information as more information becomes available as we get that. So we're just closely monitoring those and to determine how the movement of these variants are impacting our populations. Good news is we do have some preliminary reports and data to suggest that the vaccines are still effective for majority of these variants, and we just need to focus on vaccinating as many people as we can to limit the possibility of these variants causing substantial waves in cases.
All right, did you want to weigh in before we move over to Dr. Areola and to Derik on the variants? She brought up the fact that maybe the vaccines are protective against B117 and B1351.
Yeah, I mean, we have just very early information from the mRNA vaccines, again, because they have been out longer, showing that, there is reduced neutralizing antibody to those vaccines. But again, that is one single assay that we're looking at. We also need to understand the whole of the immune response. That includes the T cells as well. But, right now it looks like there continues to be protection from these mRNA vaccines. And again, I'm sure that as we move further into this, Johnson & Johnson will come out with their data as well. It's just, it hasn't been out as long as the mRNA vaccines have.
And I heard on the news on the way in this morning that in Michigan, where they've got the highest infection rate right now, that they were talking that I believe it was the B117 was what was, people were catching that variant, and that it was spreading more in younger people. They weren't necessarily getting sicker, but it was spreading faster.
Yeah.
Any thoughts on that?
Yeah, I mean, it continues to be a behavioral disease. We know what can protect us from the variants, from the original Wuhan strain. It is that masking, it's that distancing, not meeting in large groups. It's continuing to do those things. You know, if you do meet, again, outside is always better than inside. But we know that there's been a lot of COVID weariness and people wanting, regardless of what the situation is, wanting to get back to trying to do things that they were doing before. So we understand what can protect us against that as an individual, as a community. But we also see that a lot of people are disregarding some of those things. Again, a lot of behavioral issues there in the prevalence and the spread of the infection still.
Right. Dr. Areola, I heard also on the news this morning that in Michigan, they were attributing some of the spread to sporting events, but not the actual event. It was the pre-event and the post-events. I'm wondering your thoughts about the variant and what your concerns in your county.
Yes, thank you, Jessica. The concern with the variants is for the reasons that has been stated. It is potentially more infectious, and is what's clear with the variants is the more people that this virus gets or has the opportunity to infect, the more opportunity we give the virus to mutate. And the more opportunity we give for our vaccines to become less effective, and consequently, the more opportunity that we give for more serious consequences to occur. And so there's a lot that we don't know yet, but we know that masks continue to work no matter what the variants are. In Johnson County last week, we were notified that the first two UK B117 were by the state lab were sequenced, but we also have those data from wastewater tracking, so we know it's here. And so now the good news is, again, like it's been said before, the existing vaccines that we find, at least for the B117, appears to be pretty effective. There's a recent report that's not been peer-reviewed out of Israel that is showing maybe some increased breakthrough infections for the South African B1351 variant. However, the facts remains the same. I am concerned about Johnson County. I am concerned that infections in Michigan and other places are occurring in the younger population. But like what it was said earlier, the fallacy that the more serious consequences do not occur in the younger population. That's now we are seeing from KUS system reports today that you are seeing people even in their 20s, younger than 50, that are in ICU in the hospitals. And so that message really needs to get across to our people that the steps that we talk about, wearing masks, physically distancing, not only protects you against the wild variant, but the new ones that are coming out. And the vaccine, even as much as we're trying to get more people vaccinated, we're not even close to the so-called herd or population immunity. I know that there are also news out of Texas that there's suggestion that some parts of the country might be close to herd immunity. We're not. So we have a lot of work to do. If we want to get back to life as we know it, we'll get vaccinated. But while we're getting vaccinated, we're wearing masks, we're avoiding crowds, and we're physically distancing. That's the message. If we do that, we reduce the opportunity for even more variants to proliferate, but we also continue to protect ourselves and break the cycle, the chain of transmission for this virus.
Well said. Derik, what about the variants over in Shawnee County? Concerns?
Yeah, to be honest, yes, we are concerned. 22 confirmed cases of the B117. That's the only variant that we've identified and confirmed here in Shawnee County. And those two words are key because there is some limited availability at the state level to sequence the specimens, as it's called. There are some labs that can basically flag a specimen that will raise the level of concern on that specimen for the variant. And so we've been working with all of the lab partners and along with the state lab to work on a process to get some of those specimens further looked into. I will state, as Dr. Areola did and other public health officials will as well, that masks remain the most effective mitigating strategy, and that vaccine cannot be the only strategy alone to bring our infection rates and incidence rates down. They work together. They're a team, much like our sports teams. And so vaccine along with masks go together, and they should stay in place at the moment. I can also share that many of the same statistics are true here in Shawnee County as well. The incidence rate in the honestly, the 0 to age 15, that age range, we're seeing our incidence rate increase. And we have confirmed variants in that population too, associated with things like sleepovers, associated with sporting events. But as you mentioned, and interestingly enough, not the actual sporting events themselves, but what happens outside of that. And the same remains true for our schools, where mask wearing and our mitigation strategies are kind of the gold standard in our community. And we've been able to show that they're effective in the schools, but then outside of the schools in some cross district, sleepovers and gatherings and things like that, we've actually identified clusters and outbreaks of the variant themselves. And so it's just very interesting how it's kind of changing. We know that population can't be vaccinated at this point in time. And we're also seeing some more symptomatic cases in that age group too. So that's very interesting and something worth keeping an eye on. But I'll again reiterate the need to continue our mask wearing and the distancing, along with getting the vaccine for those that can.
All right, a lot of good information from our panelists this morning, but let's get to some community questions. And thank you, community, for sticking with us. I think it's been important information and updates from these counties. Jessica?
Ashley says that there are some projections are saying that we can get to herd immunity at our current pace of vaccination by July. Does that 70% refer to adults only? Otherwise, how do we reach 70% without vaccinating kids?
Mm-hmm. Yeah, I mean, that's a reasonable question. We need to vaccinate children. We know that children can reproduce the same amount of virus in their respiratory tracts that adults can. They do have the ability to spread as well, and especially when they get into those homes where adults, especially higher risk adults, are present. So, that's a very good question. We are certainly working to be able to vaccinate the whole population, even children as young as 6 months. We're waiting for those studies, waiting for that information, but that is a very good question. The more people that we can get vaccinated, the less we'll be able to spread the disease. But typically that population immunity, that herd immunity, it would include all of the people that, number one, can be infected by the virus or can spread the virus. And so that would include really the majority of that population.
Lindsay asked if Dr. Hawkinson can just clarify something he said earlier. Mm-hmm. You said that those hospitalized were vaccinated symptomatic and asymptomatic patients. So after vaccination, there is still a risk of asymptomatic spread?
So we know that, number one, you can get infected with the virus after receiving vaccination. You can still have disease, but that disease is probably not going to be as severe. Can you get asymptomatic infection? Yes, you can, but we have seen from some of the early studies from Israel in the real world, and also some other studies, one in particular that showed the amount of virus that you can replicate. You do have a reduction in the amount of asymptomatic disease, also the amount of symptomatic disease after vaccination as well. So that is a good signal. Some of that signal from Israel was that, yes, you have a significant reduction in the people that have asymptomatic disease. And so by that, we also think there is probably a lower risk of transmission of the infection as well.
All right, Michelle says, I have cardiomyopathy. I'm 55. I had COVID back in December. She had fevers, rapid heart rate, but nothing serious enough to be hospitalized. She did receive the Pfizer vaccine April 5th. Now she is sick with fever. She got headache, high blood pressure, rapid heart rate. Should I receive the second shot?
Yeah, I mean, I don't know. Is she sick right now after getting the vaccine?
She got it on the 5th of April, so a week ago.
Yeah, I mean, I would go get those symptoms evaluated, but I would still say I don't think there's anything in that scenario, again, that would say don't get the second dose of the vaccine. Yeah.
Matt says, any idea what this summer might look like compared to summer 2020? Better, same, worse?
I don't know. We have obviously our people from the counties on. We know that a lot of communities or counties around here are loosening their restrictions. So I think, it's still not going to be like 2019 where a free-for-all, everybody can go do anything they want. But certainly the more people that we can get vaccinated, I think it will look better. We are already starting to see more people at events like baseball, like soccer. Hopefully we get into the fall, obviously more people at Arrowhead. But I think it's looking that it's going to be a lot better as far as being able to do some of those things that we were able to do in 2019.
Dr. Areola, I think I saw in the news, too, that Johnson County had a big car show and a bunch of people out and about. Do those kind of things concern you at all when we still have infection?
Thank you, Jill. Yes, it does concern. It concerns me. There's no question that we have to look broadly. Right now, the weather is our friend. Being outdoor with ventilation and air circulation, that's pretty good. And so we have to be very careful that those that are our population that are 16 or younger, anywhere from 20 to 22% of our population. That's a big chunk out of those that are currently eligible for vaccination. So when I see those crowds and I see events, as long as people are continuing to get vaccinated and people are wearing masks and taking the necessary precautions, that's a great thing. But those large crowds is very conducive to the spread of the virus. So our residents need to continue to take the necessary steps to understand that we are not out of the woods yet. Things are getting better. We have 3 very effective vaccines and vaccinating across the county and across the region, and those are good things. But when I see crowds, when I see events like that, I'm still really concerned.
All right, thank you, Jess.
Dr. Wild may have mentioned this, but Glenn asked, isn't the skewing younger primarily due to the fact that the older populations were the first to get vaccinated and are, by percentage, more protected now?
In some cases, yeah. We certainly know for hospitalizations, the vaccinations of the nursing home residents cut down significantly on the amount of that population that we got. So that is something as well, but we also know more people are starting to get together, and we know that it can spread that way. So it's a combination of different factors, but that is certainly one of the factors.
Barbara asks, good idea or bad idea to get my second pneumonia vaccine 8 weeks after my second Pfizer shot? Mm-hmm. Is she in the clear to do that?
Yeah, the current guidance is to separate any vaccines from the COVID vaccine that you get by 2 weeks. So anytime after that 2-week point, you can get any other vaccines you really need. And again, that's just because there's a lack of data. Who knows? As we get further into this, we may be able to give vaccine doses, different vaccines on the same day. I know when I see my liver transplant patients in clinic or some of my HIV patients, we give 2 or 3 vaccines at the same time. So, but right now that guidance is if you're getting a COVID vaccine and other vaccines, just make sure you separate those other vaccines by 2 weeks. So you'd probably still be safe and it's still going to be efficacious. More than likely, it's just we have a lack of data to support that.
Great. One more question.
So Julie says, is there any data about Moderna or any of the other vaccines causing a full body inflammation flare that lasts for weeks after getting the vaccine, particularly after being fully vaccinated?
No, I know you can have local injection site reactions or other hives, but not necessarily a full body inflammation. I'd also kind of want details on what that means. Is it full body inflammation, meaning you're having systemic symptoms like fever and aches and malaise, or is it full body meaning on your skin you're having rash or hives or something of that nature? But
all right, good questions. Great questions. Tomorrow, KDHE Secretary Dr. Lee Norman is back with us. We're going to ask him about the variants, vaccine hesitancy, and what he thinks about COVID-19 passports. What do we do with our proof of vaccination? So you bring your questions too. Final thoughts from our guests, and a big thank you, Dr. Areola in Johnson County. I go to you first.
Thank you, Jill. The key messages from Johnson County is that our best case scenario, even as we vaccinate and open up longer hours and work with our partners and weekends and trying to reach our minority population, our susceptible population, is that the vaccine is one of the tools in our arsenal. And for us to get to that population immunity where we get closer to being able to live life the way that we knew that in 2019 and 2018, is that we continue to take all of those non-pharmaceutical public health interventions, wear your mask, avoid crowd, physically distance. If we do those collectively while we're trying to vaccinate and get more of our population, the so-called immunity, will be in a good place. Talking about how efficient the vaccines are, in December, we had 49 outbreaks. We had outbreaks in 49 long-term care facilities in Johnson County. Right now, we have 0. The vaccine works. So for those with questions, we're very happy to answer your questions. The best vaccine that's for you is the one that's available to you. They work. They've been shown to prevent death, hospitalization, and severe outcomes. There's no reason not to get it. Again, we're very happy to answer questions that you may have. We have opportunities for people to get vaccinated. Take advantage of that. Thank you.
Excellent. Thank you. Derik, in Shawnee County, final thoughts.
Yeah, I just want to thank our media friends for having opportunities like this to discuss some of the issues that we're seeing currently. And if I can kind of relate this to a sports analogy, if we went into halftime of a football game and we made our adjustments, right? We added the vaccine to our arsenal as a tool, but we got to do the things that we know work first, the mask wearing. And if we're going into the third quarter, that means we still have a little ways to go, right? And so I want to challenge our Shawnee County residents to keep it up, fight through that COVID fatigue. I promise you, we're all feeling it. We all want to work through this. I want to get back to some of the many gatherings that I enjoyed prior to the pandemic, all of the sporting events that I love. And so keep it up, work through it, wear your masks, practice the distancing, and get your vaccine when you are able to. And again, if you do have any questions, we have the COVID vaccine at snco.us. We have our phone line, 785-251-4949. And we have our website as well, shawneehealth.org, where all of our vaccine information, our case counts on our dashboard, and our COVID community indicator are located at. And so feel free to reach out to us. We can absolutely discuss any concerns that any of our residents might have. I also want to mention that Shawnee County, we do not put limits on residency. And so those residents of other counties that are interested in receiving vaccine can also do so here in Shawnee County as well. Thank you.
Yeah, that's good to know, Derik. Thank you for adding that piece of information. And Bridgette, thank you so much for joining us from Jackson County. Final thoughts this morning?
Yes, just echoing the same sentiments, just remains crucially important that we continue to practice those simple yet effective pillars of infection prevention that we all know work. So we ask residents to continue wearing their mask, washing their hands, staying appropriately distanced. We do have many opportunities for vaccines on our calendar events on our website, which is at www.jcohd.org. So please sign up to get vaccinated.
All right. We may invite you back again. So we thank you. Thank you. And Dr. Hawkinson, final words from you this morning.
I think we just need to continue to advocate for vaccination. That is the way out of the pandemic and into those things that we all want to do. There continues to be, and we'll see, tomorrow, the vaccine hesitancy. Really, that question of safety and efficacy. That argument should be diminished, and that point of contention for those vaccine hesitant patients and people should be diminished as we move further into this. But we know that the vaccines can protect you. They can also help reduce the chance that other variants will arise as well. So I think that is one other big issue there. And we'll continue to advocate and certainly answer all those questions about hesitancy.
And I would just like to add that there was a survey, I believe, that was done across Kansas, and they asked, if you were vaccine hesitant, who would you most trust to tell you? And I want to give kudos to our docs because they came back and they said, if my doctor told me that this is what I need to do, then I would do it. And I think that if you do follow your doctor's advice, every other day of the year.
Yeah.
Ask them if you have questions because they're ready to tell you what they think, right?
Yeah, absolutely.
All right. So this has been a very informative update this morning. We thank you for your great questions. I invite you to join us again tomorrow. We are going to have Dr. Stites and Dr. Weil back this week. It's a little bit of a musical chairs. I can't remember who's up to bat tomorrow, but tune in to find out. Make it a great day.